Hi everybody, I'm Learne Durrington and I have the privilege of being the CEO of the WA Primary Health Alliance, and I have with me here today, and we're doing this remotely as you can tell, Dr. Wren, who's the principal of the Quinns Mindarie Super Clinic in the northern suburbs of Perth. So Lynn's a bit north, I'm a bit south, but we're having a really interesting conversation today because Lynn has been a participant in our comprehensive primary care program, which started a few years ago now, with a number of willing practices across WA, and I think we have well over 100. But your practice has done some amazing things in these last months. So would you be, I guess, able to describe just for you how the partnership and participating in comprehensive primary care has worked for you in your practice and in the context by which you serve your community?
Wow, look, it's a really difficult question to summarise. I mean, I think for us, it's very much been a journey. In fact, just a couple of months ago, we have a whiteboard in our staff room, and we got the change innovation curve kind of up on the whiteboard, and we asked all of our team members to take a little sticky note and put themselves, where are you on the change innovation curve, everywhere from down one end where it said, I want my fax machine back,
yes,
to somewhere up on the top kind of going, well, this looks interesting, but what are those weirdos up to? And then right down the other end it was kind of like, oh, I love this shiny new thing. And so I think that was really a good reflection of our journey over the last 3+ years being comprehensive primary care practice.
I'm interested though, from your perspective also, what do you think the benefits have been for your patients?
Yeah, I mean, obviously there's the patient benefit aspect, and then the team,
That's right.
But I mean, for us, it's a resounding, the benefit for the patient is just a resounding, amazing, positive thing. I mean, even just simple things like when you start looking at the building blocks and how we're going to start that journey to be a comprehensive primary care practice, you start with very simple things like data quality and continuous quality improvement activities, and so just being able to grow in an awareness of how we can use our data to identify patient healthcare gaps, and from that, then obviously come up with quality improvement activities, which will then, number one, identify patient healthcare gaps and then enable us to actually improve patient healthcare outcomes. Yeah.
If you were to describe the motivators, what are the motivators for you because this takes time and commitment and energy?
Look, I think, as I said earlier, the fact that we're aware that the landscape of primary care is changing. The motivator is there that I think all doctors, I truly believe that all doctors, or the majority of primary care physicians, GPs, really want to offer quality healthcare.
Yes.
And I think what's happened for us as a practice is that through being a comprehensive primary care practice with WAFA, the practice has become like the engine, so that we've got the tools, we've got the foundations, we've got the things that we're putting in place behind the scenes to enable doctors to operate at the top of their scope.
Yes.
Enable our nurses to operate at the top of their scope. So as we add different team members, and through WAPA, we've had the amazing opportunity of having a pharmacist in primary care, a social worker in primary care. We were really interested in the medical practice assistant in primary care, and we see an amazing role for that. And we actually ran our own pilot around that. And all of that added to this team-based care, and adding each of these people to it just essentially means that particularly GPs who are, resource poor in terms of time.
Yes.
It's not that we don't want to be, health promotion and coaching and identifying healthcare gaps, and that's our vision. But on a day-to-day basis, how are you going to fit that into your day and your consultations?
As a clinical leader, as a practice leader, for you, What's your one takeaway that you can say, gee whiz, I've done that?
I've done that. I think being a comprehensive primary care practice for this last 3 to 4 years has been the most phenomenal time in terms of growth, energized, feeling amongst the team, growth in terms of just the way we do primary care, and just the excitement about being able to continuously improve what we do.
Yeah. Lynn, thank you so much for giving up your time, but also for your clinical leadership with this program of work over the last, nearly 4 years, as you said. I can't believe it's that long. But thank you so much for your contribution to the primary care system and the work you've done.
It's a pleasure. It actually has been an honour and an absolute pleasure to have this opportunity through WAPA. Yeah, and I say that very sincerely.
Thank you very much. Thank you.
Okay, thanks, Leanne.